Hello, my name is Phil Pereira, and I'm the Emergency Ultrasound Coordinator at the New York Presbyterian Hospital in New York City. And welcome to SoundBites Cases. In these short educational video modules, we hope to cover a range of topics in basic and advanced ultrasound applications. It's my hope that through these ultrasound videos, we'll be able to improve the clinical care that we can provide to our patients at the bedside and come to the diagnosis more rapidly than using traditional testing. So without further delay, let's get right into today's module.
Today's module will focus on the ultrasound imaging of abdominal aortic aneurysms. And here's an illustration showing the various types of aneurysms. The more common type are fusiform, a diffuse dilatation of the abdominal aorta as seen here to the left. Notice that most abdominal aortic aneurysms are going to be infrarenal as seen here to the far left, and that they can extend down into the iliac artery as seen here in the middle picture. Now, a AAA is defined as greater than 3 centimeters in diameter. The less common type of AAA is a saccular, as seen here to the far right, where you have an outpouching of the wall. Now let's review an actual ultrasound image of a large abdominal aortic aneurysm. B-mode or grayscale to the left, color power Doppler to the right. With the small imaging arrow, I'm showing there the large AAA, and notice the very important landmark, which is the spine posteriorly to the abdominal aortic aneurysm. And notice its bright or hyperechoic bone table. Notice the power Doppler here to the right, showing the pulsations. Now, if we put measurements down on that abdominal aortic aneurysm, measuring in short axis as we should so as not to underestimate the total diameter, we see that this is a large AAA, 4.8 by 4.9 centimeters, making the criteria of a AAA greater than 3 centimeters. Here's an interesting abdominal aortic aneurysm with a very large burden of clot, circumferentially surrounding the very small lumen that's left in the middle of this abdominal aortic aneurysm. Again, this is a short axis view, and note the onion skin peels of thrombus that have accumulated around the walls of the lumen. That small black area, all that's left within the AAA. Here's a long axis shot of the same aneurysm, and we can see here the lumen in the middle, and notice all the burden of clot both anterior and posterior. I like to categorize this as the Subway sandwich sign with the large loaves of the Subway bread, both anterior and posterior making up the thrombus, and your filling signifying the lumen interiorly. Remember that we must include in the measurement of the abdominal aortic aneurysm the clot burden. And here we can see that if we put calipers down and measure down from anterior to posterior, including the thrombus and the lumen, that this AAA measures 6 by 6.16 centimeters. And we could underestimate the AAA if we just measure the lumen. Here's an extremely large AAA in short axis, and we can actually see the swirls of the clot that are about to accumulate within the AAA from the chaotic flow of blood within this very large aneurysm. And we can also see peripherally the clot that has accumulated on the walls. Here's a long axis shot of the same AAA, and again notice the chaotic movement of the blood within the AAA and the deposition of that blood onto the walls of the AAA, making up the thrombus both anterior and posterior. In the next image, I'll put color power Doppler flow down, and notice the swirling of the blood within the AAA, and it's that chaotic blood flow that actually predisposes to the accumulation of thrombus within the walls of a AAA. So again, color power Doppler, again showing that this is a vascular structure consistent with a very large AAA. And if I put actual measurements down in short axis as I should to best measure the AAA, notice that this is an 8.8 by 8.6 centimeter aneurysm. So this patient went directly to the operating room for operative repair. Here's an interesting aneurysm, a very rare form, as most aneurysms are fusiform with a diffuse dilatation of the aorta. This is a saccular aneurysm with a small saccule coming anterior, and we see a small bump coming off anterior on the aorta as shown here. If I actually measure the diameter of this aneurysm, it comes out at 4.45 centimeters, a very rare saccular aneurysm, much rarer than the much more common fusiform or diffuse dilatation of the aorta.
So thanks for tuning in to today's installment of SoundBites Cases. It's my hope that through this educational series, I'll be able to get out to you a number of ultrasound learning pearls that you can take to the patient's bedside tomorrow to improve clinical care and to arrive at the diagnosis more rapidly than using traditional testing. So I hope to see you in the future as Soundbites Cases returns and as we move on to discuss a range of interesting topics in bedside ultrasonography.